of bacteria, but many other infections as well.
All right, thank you for explaining that, Doc Hawk. Thanks so much. Any reporters on the line today? Let's get to community questions because we've got a few here. Lexi wants to know, how often does cancer come back? I mean, I know that's a very vague question because I would imagine it's the type of cancers. What can you tell us about that?
Yeah, that's such a good question, and it's one that we get often because it's anxiety provoking for patients. It really is very personalized to each individual's journey, and remembering, as we were talking about just a moment ago, that your risks for cancer are not just related to your prior cancer. There are environmental factors like, are you a smoker, are you not? There are health factors like, have you had the HPV vaccination or not, which we know is one of the vaccines that can help prevent cancer. But cancers come back in terms of the primary returning less and less as you get farther out from treatment. So we do often think about 5 years as kind of a really important milestone. I think Laura shared in her original experience the celebration that happened when she was at the 5-year mark, and that is something that is important, and it's a timeline distinction we think about because the risk of return drops so dramatically after that time.
Kyla, I'll let you answer this one. Becky wants to know, do people age out of the adult survivorship transition clinic, or can they stay there for life?
They can stay there for life. We kind of think of, as you age, we all have increased risk for different things. These patients have a little bit of accelerated risk, so meaning that they could develop, like if they were to develop breast cancer, that could happen earlier, which is why we start screening earlier. Same with colon cancer. We start colon cancer screening earlier if you've had radiation in those zone. So it is something that we'll continue to monitor lifelong, and they can come and see us once a year and then continue to see their primary care provider.
That was my question. Is this just an extra layer, meaning these survivors are still going and doing all their screening, seeing their...
A lot of primary care providers will say that they're not comfortable with the survivorship, so we like to partner with them. We still want them to continue to have that relationship with their primary, and then we will send the treatment summary, our recommendations back to their primary, and then make sure that they're getting the screenings that are pertinent because of their history, and we'll do those every year.
Laura, I'm going to leave this last question for you. It's from Tina. She says, is it possible to, quote, put cancer behind you or move on from cancer? Kind of, what do you do with it?
That's an interesting question. I don't think you can ever put it to the side and move on. I think it's always in the back of my head, or sometimes, as my sisters like to say, I pull the cancer card, which it's always in my back pocket and I can always pull it. I think that it's always with you, and I think that's a good and a bad thing. So I think it helps, like I mentioned, it helps me stay positive because I know what I've been through and I know how far I've come. So I think that it's, am I glad that I got cancer? No, but I think that it's made me who I am today. And yeah, I think it's something that I carry with me and think about a lot of the time. So I don't think it ever leaves you. The journey is going to be with you forever, especially if you're proactive in your health journey. You have to stay on top of it and always be getting the recommended tests and scans. So it's never like out of sight, out of mind, for me at least.
Absolutely love this conversation today. Just really important, and love knowing that a resource like yours is here and patients and survivors like Laura are using these services. Laura, last question is for you from me. Tell me about the spoons behind you.
So, okay, this is in my dining room. These, this way. These are my painted spoons. I got this weird idea, and I was like, I want to paint spoons from a thrift store and then glue them on the wall. So I told my husband, he was like, okay, go for it. So I hot glued a bunch of painted spoons to my wall, and I think it's really cute and fun, and it's a great conversation starter. So, that's one of my creative outlets, is doing weird, random things like that.
Well, I love it. It's so artistic. I've been looking to steal people's ideas because I'm doing some decorating at home too, and I was like, I like your idea. Of course, I'll try doing it, and it'll be one of those Pinterest, like, this is what it looks like online, and this is what it looks like when someone tries to recreate it. I'm sure mine will look awful, but thank you for the wonderful, beautiful, artistic idea today.
Of course.
It looks great. I love that you're using art to kind of